forward here. All right. So Aaron, thank you so much for being willing to chat today about yourself and your experience. And also, you are a mental health professional, so you have a particular lens you're also seeing this through. I'm going to give you a chance to introduce yourself and whatever identities you want to make known right now. And then we'll kind of get into our conversation.
Thanks for having me. Yeah, so I identify as he and him, white, cis male. I am gay. I identify gay. I'm married. I'm HIV positive. My partner is HIV negative. We are in an open marriage where we share that information back and forth. That's what works for us. We've always had an open marriage. We only have one rule in our house, is that nobody comes before each other. So, but it's worked out really well, and we can certainly talk about that. But I think polyamorous and open marriages or open relationships take a lot of communication. But for some people, they're the answer.
Yeah. Yeah, I've heard that from polyamorous and other folks in more open relationship. They talk about a lot of the emphasis put on communication and trust, and it sounds like maybe that's similar for you guys.
Absolutely, yeah. It's when we went to an open marriage, I was diagnosed with HIV June 6, 2011, and it's never really been an issue for me. It never really impacted my sexuality. But there came a point in time where I had a little bit of a mental block that I did not want to transmit the virus to him. And so that was one avenue for us to have an open relationship. And then the other thing is, I'm not a monogamous person. Over the years, I had lots of challenges and lots of problems, and I would beat my head up against the wall and say, what was wrong with me? What's wrong with me? And what I had to really come to the conclusion, and so I'm 40, I'll be 41 in 2 days. How we view sexuality as a community now is a lot different than it was 10 years ago, how it was 20 years ago. So, back in the day, if you had multiple partners, you were labeled a lot of things. You're unfaithful, you're this, you're that, and you're other. But what I came to the realization when I was introduced to the BDSM and the kink community as a whole was, no, there's lots of ways you can view yourself, and there's lots of ways to navigate relationships and partnerships, and that we don't have to fit within the construct of a heteronormative framework. In some ways, I think that marriage equality was the worst thing that happened to the LGBT community ever. Now I say that with the privilege of saying I'm married and I have a 17-month-old son, and so there's a lot of privilege that comes from that statement. But what happened was, whenever lobbying groups pushed for marriage equality, in order to get mainstream society to accept that, we had to paint a picture of the white picket fence and that normal, right? That Leave It to Beaver kind of apple pie, American baseball, all American family. That didn't necessarily look like my family or other LGBT members. And to go a step further, we left a lot of people behind, including the trans community, who it isn't just under this administration that the trans community has been ostracized and marginalized. That's happened. It's just more under this administration. So that's how I kind of, the convergence of where I am now. And when I came to the kink community, really finding that narrative that there's nothing wrong with you. You're okay just the way you are. And it's actually everybody else's problem to deal with.
It's sort of the outside gaze that you sort of need to shed, it sounds like, and just own who you are. I also hear like freedom in your statement there, sort of freedom to accept who you are. Is that fair?
Absolutely. A lot of people, so I'm really involved in the leather community. So that's what really drove me to kind of the community as a whole. And there's a lot of history to it.
Mm-hmm.
A lot of people just think kink. Well, leather was really a political movement. So coming back from the world wars, you had a lot of gay men who were in the military. I was in the military, and that was before Don't Ask, Don't Tell. I was actually discharged under Don't Ask, Don't Tell. When I outed myself, several of my soldiers were being harassed by top leadership. And, you know, I was honorably discharged. I enjoy all my VA benefits today. And I went back and had my discharge upgraded. So I still have the old one that says why I was discharged. I say all that to say that, you know, leather was a space that when these gay men came home from war, they had this erotic, homoerotic, uniform experience from being at war. And when they came home, they didn't have a place for themselves. And so they started to find leather clubs, and they found the underground. Because remember, society didn't accept LGBT people at that time. And so that was really where leather came into be.
So
that met its space.
You said World War I, II. Which one are?
One, but mainly out of two.
Okay, so we're
World
talking
War II.
late 40s, early 50s.
Exactly.
Okay.
Yeah. So a lot of, you know, relationships started at war. You'd be spending a lot of time with your you know, colleagues, your fellow soldiers, and you know, those high stress situations, they were forced in some ways to find these really close bonds. And so when they came home, they found the outlet in leather. And then over the years, it's changed. But I always ask people to really, when we look back at like Stonewall, and when we look back at imagery from past pride parades, and you'd see people leather clad or in chaps, it was a form of rebellion of saying, we don't have to look the way you want us to look. And so, you know, I've been very open that whenever I've done protests with Ferguson and the Stockley verdict and so forth, that I wear my leather out, because for me, leather is a political statement. It is a sexual statement as well. I think that's when the multiple identities really converge of empowerment, like empowerment sexy. And so you start to see the power dynamics of dominance and submission. And really, when you think of any of the kink paradigms, whether it's pup master, dominant, submissive, sir, whatever that may look like, that's always the power differential that starts to, it looks in a lot of different ways, but it's really simple in that.
Well, it's what's been at least explained to me by some clients has been it's sort of like playing with power, you know, in a way that in the real world you can't play with it. Power will kill you. And so but you can in the context of a sexual relationship or a partnership, and in that way it becomes a choice I'm making, right, as opposed to like something I'm being submitted to. I don't know if it sounds.
Absolutely. Yeah. In some ways it's escapism. So I see a lot of folks who are, by day, they are decision makers, high pressured, a lot of demands placed on them. And by night, they want to escape that. They need to escape that. And so I think for them, the playground, if you will, is BDSM. I always find it interesting that, you know, back in the day pre-COVID, JJ's, one of the most well-known leather bars here in St. Louis, about 1:30, 2 o'clock is popping. It is the place to be. And by that time, you will have a hodgepodge of folks who have come from all the other bars. And you see people trickle in because they have a little bit of alcohol in, their inhibitions are down,
Mm.
and now they're less afraid of what people will think about them. So that really gives you a snapshot into it. I think a lot of times people have desires or curiosities, but for a variety of reasons, they may not be willing or able to verbalize or even admit that.
Hmm.
And so that's, and some never will. I had a boyfriend who I dated who was at WashU, and you know, this person went on to go to an Ivy League school for graduate school. Now is a high profile person working in finance. So it would not be possible for this person to share anything of their proclivities inside the bedroom.
Hmm.
So for them, it's an escapism. Others, it's also a form of trying to navigate trauma. Um,
Yeah, that was something you had mentioned earlier. It sounds like that's another, or that's a lens through which you view this as well, in terms of working through trauma or reenacting it in some ways to try and master it, to try and have control over it. I don't know what your sense is about that.
yeah, I think so. We're I think navigating the mental health space now, right before it was, I didn't have the academic training. Um, you do see patterns in people's behavior. So if it's not uncommon if a person had a sexual assault, that if they want to have empowerment over that and they've reached a point of being desensitized to it, they may seek out that situation again.
Mm-hmm.
And it may get to a point and where it teeters on the unhealthy side, where only that can help them reach climax. And so they need to recreate every single step. And so we were talking about obsession and that compulsion, and it teeters on that, where it's no longer beneficial or healthy, and it really eats up all of the brain capacity trying to relive that.
Well, it's sort of what I'm hearing you describe is sort of like takes over in some way. And it's not like it's a choice they could make. It's more like have to. Like,
Mm-hmm.
oh, that would be fun tonight. Oh no, I have to do that in order to climax at all.
Mm-hmm.
And that sounds like a line for you, like an indicator that we have crossed over into a compulsion or addiction, or some kind of trauma response that maybe needs to be attended to in a different way. Is that?
Absolutely. Yeah, absolutely. And I think in any of the kinks, BDSM, um, any of the play that is outside of, traditional bedroom, for some people, if you say what's kinky to you, and they might say having sex with the lights on, right? So that might be to that person. Whereas to another person, I say what's kinky, and they, I want tied up. I want you to whip me with a fire flogger while hooked up to electrodes. Like, it just really runs the gamut. I think the difference is for any of those, whether it is that missionary sex or the more, more out of that mainstream, is consent. And consent isn't a single space or single time activity. And you mentioned it earlier, it's really about headspace. So it's about the, people that are engaged in kink behavior. It's less about the activity and more about the thinking that goes into it, right? So it's a scene. And you can, as with anything, you can have people that are healthy or unhealthy. Unhealthy practitioners of kink are folks that do not continually check in with the person they're playing with. They're not continually checking in for consent, because playing in that space, you really have the potential of hurting someone, not just physically, but mentally. So if, and there's some where you can just clearly see if there are folks that are engaged in, let's say, fisting, you can clearly see you could hurt somebody. So that's very obvious. But let's say you're a person that's engaged in race play. And race play is typically engaged where a person might want someone to engage as, let's say, a plantation owner, right? So it's a racial component. I had someone one time that wanted me to engage in that. And I said, that's a hard pass for me. I can't do it. I just can't. So you have to know your limits.
Sure.
So why is a person wanting to do it? And then you have to know that at any given point that, degrading someone during the course of a, sexual playtime, could that lead to them going home and trying to hurt themselves? Could it lead to them attempting suicide? Absolutely. Absolutely.
Yeah. And so in that way, you need to be conscious of the risks you're taking. And also I'm hearing too a bit of like some responsibility then on your part to be responsive to that or know your limits and the ways that you just are like, I'll play all kinds of ways, but not like, I consciously can't do that. Have you seen some of the, I went to a conference a couple of years ago and there was African-American studies person talking about research on BDSM and the Black and African-American community and sort of trying to wrap their minds around it in terms of it being about conquering, right? The race wars or whatever, or conquering at least themselves. And then sort of that, and then he talked about historical trauma, maybe some of what you're getting at. And so I don't know how much you've seen that.
I'm not that experienced with it. I've, there's been lots of conversations with it, and even within the leather and kink community, in the last, let's say, 5 years, you've seen a resurgence or a rising of the Onyx. It's a club for Black and Brown community members, and so this, white leather individuals can be associate members, but not full members, right? So there's opportunity, and navigating and creating spaces. I think the leather community and the kink community are as complex as any other segment of our society.
Sure.
But their conversations are being had. But yeah, that trauma piece, I think, is a pattern that I see more often than not. Whenever I get somebody that wants to play, I had someone the other day that we were navigating a play scene and what that would look like. And I said, what would be a safe word for you? And this person said, I don't want a safe word. And I said, well, I'm sorry, that's not how I get down. Because there's a couple things I have to, by law, do. So for me, I have to always disclose that I'm HIV positive. And because I've been involved in enough cases where there's been prosecution, I always take screenshots, and so that's what I do. That's because I don't trust the system, but that's what I do. And then the other thing is continually checking in with the person. Are you sure you want to do this? Making sure the other person's in control, because what you were saying about the power and then the power to control, there's a manual. It's called the Boy Bill of Rights.
Oh, okay.
And it basically says that a person that's in the boy role, these are the rights that you have. You have the right to have a dominant that is going to protect you. You have a right to have a dominant who is never going to place your health or mental health at risk. And so, to put it in another way, it's, and I'm not, I have to be careful how I say this. I am not dehumanizing people. But it's like the adage of, you have a toy box,
Mm-hmm.
and if the toys in the toy box are broken, it's no fun.
Mm.
So the same goes with your sexual partners, that you want to keep them as healthy as possible, not only for them, but also for you.
Mm-hmm.
That, I view all my sexual partners as, I have relationships with them. I know them. Now there's boundaries. I don't want to know them too much. We'll have short conversations, and I know brief things about them. But I want to keep them as healthy as possible for those reasons.
Yeah. Yeah. It sounds like you said did you say call it the boys' Bill of Rights? Is that what it? So it sounds like there's also when I hear about like that kind of, I'm going to call it documentation, but like
Mhm.
that we're writing this out, it sounds like sort of baked into the culture or community is these sort of documents that allow everybody to sort of be on the same page or be signing up for a particular kind of relationship that holds in place our humanity, and doesn't see that as separate from what we're doing or the play that we're engaging in.
Yeah, I think, again, looking at this type of play on a spectrum, right?
Mm-hmm.
So I would consider the type of play that I engage in is very average. I know that others probably wouldn't. But then you can push a little bit further, and that's when the clarity is less clear.
Okay.
So when you start moving into sadistic type of scenarios,
Mm-hmm.
when you start getting into blood play,
Mm-hmm.
when you start getting into body modification. So, how do you navigate that whenever, you have and I've done blood play. You have to navigate it with everybody. Um, and how do you navigate when you're done? Um,
Mm-hmm.
so there's a certain bit of, there's that physiological response of endorphins being released. Um, and then that can be too much. So the aftercare of all of that
Mm-hmm.
is really more important than anything else. And so that's the other component. The consent and aftercare have to really be the bookends to whatever behavior is going on.
Yeah.
And when you don't have one or the other, then that's when we really start to see folks that are not, they shouldn't be engaging in the behavior. And I do see it a lot with folks that think they're dominant.
Mm.
They'll take on that banner, that title, not knowing what it means.
Hmm.
Anyone can flog somebody. Anybody can inflict pain. That's easy.
Sure.
How do you nurture the person after they've went through that experience,
Mm-hmm.
and share space with them in a way that doesn't injure them mentally or physically?
Right, right, right. Can you talk a little bit about that aftercare or what you see as being important about that bookend?
Yeah. Well, I think it's something that's not talked about enough.
Mm.
So there's the physical piece. Obviously, if I am, if I've engaged in a flogging session with someone, I want to do wound care with them. If I've drawn blood, if I, that may entail, all the things that we think is antibiotic, ointment, or putting dressings on it, or putting ice on it. But there's also that person inherently is going to think in the aftermath, because leading up to that climax, and my brain is full of dopamine and endorphins, and it is going, and I'm there. And it's very similar to addiction, right? So our brain is kind of responding in similar fashions. Well, once that's occurred and we've hit that wall, now we're deflated.
Hmm.
So
Hmm.
what the person really needs to hear is, you're okay.
Hmm.
There's nothing wrong with you. What we just experienced was beautiful. And then how did you feel about that?
Hmm.
Is that something you want to experience again? And that's, I don't think that, well, I think some people don't engage in that because they're not aware of it. And then I also think people don't engage in it because, quite frankly, they themselves do not have the capacity or the self-awareness to think of others. So I've gotten off, and that's all. It's kind of that mentality of, and that's not the way a kink scene plays out. It's long after both individuals have climaxed. You don't just like wipe off your hands and like walk in the other room.
Yeah, I'm hearing, and I'm hearing some like we need to have some kind of resolution or some kind of like coming back together around this, reinstating our care or consent even, or responsibility to each other. I'm hearing also some processing of the experience, where we both sort of walk through it and it doesn't become like an abrupt end. And I'm left with my feelings or experience and you're left with theirs, and there's sort of this disconnection that occurs. I mean, I'm hearing sort of this almost coming back together after it's done. Is that fair?
Yeah, I absolutely. And I think we have to have that. And what I find as our society, and I'm going to speak in general sense. So working within the HIV field for the last 10 years, we do not navigate conversations around sex well, if we do at all. And so, if you think about it, you might meet somebody at a bar, and we can't typically even have a conversation of, are we going to use condoms? What protection are we going to use? Oh, by the way, do you know your status? When was the last time you were tested? So these are all like no questions. I don't, on top of alcohol being in the mix and things like that. So to now expect that we're going to have more in-depth, more developed conversations centered around how we are as an individual, and I to a degree, I think our society is lacking in empathy in every facet of our being. It is very hard for us to empathize with others because we otherize people. For me, the kink community, it offers a very limited space where, in that intimate setting, I'm able to connect with that person and empathize with that person. But yeah, we have to do better with, will a majority of the folks engage in kink? Probably not. But if to the point of that we ever expect to end HIV, that's going to hinge on our ability to have conversations around sex, and to do it in a way that is not defensive. I was in a relationship with someone, and initially at some point they did not want to have sex because of my HIV status, and they were afraid to tell me. And so after we talked, I said, well, that's not a deal breaker. There's a whole bunch of other activities that can go on, and for me, that's actually not, I find myself versed, and so there's a lot of things you can do. To me, that kind of conversation is sexy because it's really a person revealing their intimate self. Like, that takes a lot of vulnerability to say, I'm scared to have sex with you because you're HIV positive. That can be labeled as ignorance. It can be labeled as, oh, you're this, you're that. I don't see it as that. I see it as, I'm scared. And when we were able to talk through it, it was never an issue. Like, we had sex, and it was a great relationship. But that's just one example that I think we have to be able to navigate those conversations and the aftercare and those after conversations. I am that person that after the fact, I'll go through kind of that mental checklist. Did you like what we did? What could have been different? I do a performance review in my head, because sex isn't all about me. It's about the other person.
Mm-hmm.
And nobody wants a partner that's just laying there and just like, oh God, let's get this over. Hopefully that's not the goal. Like, we want to actually enjoy
Yeah.
coitus. So
Yeah. Well, you're making me think of, I mean, shoot, I wish my couples who weren't into kink and BDSM would have that conversation afterwards. Like, you know, and before, right? So there's a wonderful sex educator, and I'm totally blanking on his name. I was trying to think of it, who uses the metaphor of ordering pizza. So when you order pizza and you share pizza together, you say, what would you like? What do you feel like tonight? Do you want some of that? Maybe you want some of that. You know, I'm really feeling about this. And then when it's done, you go, how was it? Was it good for you? Like, this is what we do, right, around other topic areas. So we know how to have these kinds of conversations, but the topic of sex is sort of like the one where we don't do that, you know, and we can do it about pizza, but we can't seem to do it about this topic. And if I'm hearing you right, you're sort of saying, like, if we could do that more often, if we could show some empathy and care and concern for what our partner wants and how they experienced it, man, we could have a really different culture in a lot of ways.
which is really interesting, because we live in such a sexualized society, right? And so in some ways over sexualized society, where and there's multiple examples, and there's other classes that go into that, but you know, we start sexualizing girls very early.
Babies.
It starts right in the nursery, right? That baby's so pretty, so beautiful. Oh, look at that hair. Like, everything is, you know, so it starts very early. And then it starts with the boys very early. Oh, he's such a masculine boy. Oh, he is just so big. Look, he's going to be a hockey player. So we start really pulling out those traits that, you know, from evolution has really served us well, right? So that really dominant male could be the caregiver, and he could provide, and we don't have to live like that anymore. So
yeah, and we almost like close in on our children, their possibilities when we do that, right? We kind of go, and here's who you are. I mean, we didn't ask you, but we just start closing in the walls before they even get a chance to walk. Like, we've decided for them, kind of.
we you know, I think to your point about having conversations, you know, we do have that sexualized society that we live in, but then we also have that really odd relationship that we have with religion. And religion, in particular evangelicals, you know, I think has always been the bane of existence for anything other than, you know, what's in the lane of the religious community. Now, this coming from, I was an ordained minister, and I grew up in religious homes. So you know, if religion works for folks, that's great. I have found more folks that come from religious homes that have to be told they're HIV positive, or have to be told that they have syphilis or STDs, or that they have an unplanned pregnancy. And we can't be ostriches and put our head in the sand, right? And so I think a lot of the challenges that we face, certainly not in and of itself, but that is one of the things where we have to find a way to coalesce spirituality with reality, spirituality with sexuality. And you know, an ex of mine who is Mexican, whenever we first got together, and he would tell me that in his home, sex just wasn't talked about. So those cultural differences, right? That in a Latino home, in his Latino home, sex was not talked about. It was not acknowledged. And so he went away to university, not having any knowledge. And so it's not unique to just religious. I mean, in each culture, each group has their own nuances that need improved on. but we have to reach to a point where we can at least have conversations.
Yeah, so I just finished the book, Boys and Sex by Peggy Ornstein. Have you seen this book?
I have.
So in one of the last chapters, she deals with exactly what you're talking about, which is sort of like, we don't talk about sex. And actually the stats, what you just described in terms of evangelical and highly religious families and sex of the population, they end up with more unplanned pregnancies, more STDs, earlier sexual encounters actually, than for folks who have more comprehensive sex education or parents who are more open about it. And so there's this disconnect between what religion or your religious community is saying and what happens in reality, like the actual outcome. And so hearing you say that, I just keep thinking about that last chapter and like highlighting everything, going, yes, yes, yes. We really need to inform people so that they can make informed decisions for themselves. And they have the language to communicate about what they want, about what they desire. She
Mm-hmm.
also takes to task this whole issue. We don't talk to kids about pleasure, sexual pleasure. We always
Yeah.
talk about risk, right? We always talk about problems. And I think about that in terms of like, how would you even enter the kink community if you don't have a sense of your own desires and pleasure, but you're
Yep.
always sort of focused on risk, or you're sort of too scared to even enter that space. I imagine you've run into people who've struggled.
Yeah. And we were talking about some of these societal norms that start very early. I'm a new dad, so my son, he'll be 18 months. But I'll give you an example of how the things we're taught creep into that next generation. And it's very subtle. Um, so the other day, my son was having a bath and he's playing with all his toys and he discovered he has a penis. It's just, lo and behold, it's there. And so he was just mesmerized by it and pulling on it. And what do you think I said? Don't do that.
Yeah.
Don't do that.
Mm-hmm.
So now that's, is that going to leave a traumatic mark for him? No. But what I did, and inadvertently, what I was telling him is that there is something shameful. There's something wrong with that part of his body. And that's the subtle ways that I think coding from society bleeds into. Now, obviously, we want some of that because you can't be outside at school, playing with your penis. It's frowned upon. For a variety of reasons. But that is, I consider myself, I'm a very liberal person. I try to be as culturally competent as possible. And even in my own life, that messaging creeps in. And so I think that's an example of how we always have to be checking in with ourselves and how we're parenting and how we are relaying those messages to our. I hadn't thought about that pleasurability piece, but I think it starts as early as anything else. A friend of mine was telling me about how they're potty training their kiddo, and so their son will go behind the couch and squat down and use the restroom in the diaper.
Oh, sure.
And so they'll yell at him and say, "Are you pooping?" So they're trying to get past that, but these little subtle ways that you don't want to shame, you want to promote health, and there's no handbook on it. It's just you do the best you can.
Yeah, no, I totally agree. So I have 2 kids. They're both through potty training, thank God. They're 6 and 10. But similar like auto responses as a parent, whereas like as a professional and a person, I'm like super open and sex positive and blah, blah, blah. But like with my own child, it's sort of like there's no thought. I just say things and then I go, oh, nope, that's exactly what I said I wasn't going to do. And crap, like how do I pull that back? Because it's that automatic response, I think, that becomes hard to manage because we're not always thinking about it.
We're conditioned, right?
Yeah.
And I think that is, I'm hardwired. I grew up in southern Missouri. My default, I will tell you, my default in my home, my own home, is I am the caregiver. I'm the primary breadwinner. I am the dominant. I am, I am like what I expected a father would be.
Hmm.
And I have to always fight against that.
Mm.
So I think anytime we start talking about privilege and we start talking about roles, yes, some of these things we are hardwired because society, I'm 40 years old. So I've had 40 years of society telling me how people should behave.
Mm.
Um, that doesn't give me a pass for behaving that way.
Sure.
That I have to continually check in with myself. And so checking in with my partners, but more importantly, checking in with myself and saying, is the behavior I'm displaying the type of person I want to be?
Mm.
So in a sexual space, do I want to be that person who is, takes energy from people, but doesn't give energy back?
Yeah.
And so that's for me very important, that I always want to, and the feedback helps, right? The feedback from other people helps to inform. Otherwise, I'm just correcting myself, and geez, that's a horrible thing to have, is I'm only going off my own feedback.
Yeah. Yeah. We do need people to reflect back to us or let us know the impact of our behavior, or the experience. Otherwise, left to our own devices, most of us are pretty narcissistic and will make up all kinds of grand things about ourselves.
Oh, yeah.
Or like, I guess I've seen with myself and clients, horrible like shaming moments where it's like, it actually wasn't as bad as you think it was, that kind of
Yeah.
thing.
I
Um,
always, whenever patients leave my office, I always tell them the same thing as they're leaving. And I heard it once in a recovery meeting and I liked it and it's just stuck. You're neither as good or as bad as what you think. And so we silo ourselves, and then we go down that rabbit hole. So I think it is important for us to remember within the kink space or any of the things that we've been talking about, that to be in the moment, right? And so, you know, maybe I did something yesterday and I had some feelings about it. Well, I need to talk to somebody about it, but that doesn't mean I have to do it ever again. I've done things before that it wasn't my cup of tea. Didn't particularly find any value in it. It didn't make me feel any sort of way. And so I marked that off and I don't revisit it. We have to be able to give ourselves permissions, and be kind to ourselves. And I think that's really what it's ultimately about, granting ourselves that permission to feel some sort of way. It's not always going to be good. And then, I would recommend that anybody that's engaged in kink, I'm lucky I have a therapist that I'm able to communicate openly with. So if I have something that I think is correlated to a certain behavior or a certain activity, or maybe it made me feel some sort of way, communicating that. And as I talk with clinicians and providers, that's really the practice you want to aspire to have, where your patients feel open and free enough to be able to share these very intimate pieces of themselves.
Yeah, and be able to process that with you and kind of think through it. Not necessarily, when I'm working with my students or I'm supervising people, I sort of say all the time, like, one of my jobs in my office is sort of like anything can be said in here, like we can go for it. And they need to know that what will come from me is curiosity and trying to understand, as opposed to sort of what I know happens a lot around sexuality and particularly kink and BDSM kinds of play is pathologizing like too quickly or like jumping to some conclusion about what that means, as opposed to sort of like helping that person walk through it, and come to their own understanding of it. I don't know if that sounds fair to you or what you would recommend.
And that's actually a really great point that, when you're a hammer, everything looks like a nail, right? And so I, I deal with trauma, and so on any given day, 98% of the people that will sit in front of me are using drugs or alcohol or other behavior, and they're finding a way that works for them to try to cope. So I do think that the best thing that we can do with someone, so if there is a trauma, right, it's very clear. I think ensuring safety for that individual, normalizing and validating how that person's feeling. Mm-hmm. And then also working with the person on negative talk. Yes, let's not label it. This is what you're doing right now to be okay and to feel okay. And we have to view the activity as a means to cope. People use whatever tools that they have available, right? And so folks will look at my substance, patients that are using substance use, and they'll say, "Oh, how horrible! That's horrible. That person, they're this, that, and the other."
Yeah.
I don't see them in that way. I see all the folks I work with very strong, very powerful, and actually very smart. They've managed to find something that works for them, and I've never seen a lazy heroin addict. They don't exist because it's a lot of work. And so I think we just have to view the mechanism as different. So for an individual that's trying to navigate trauma, their means of navigating that looks like trying to regain power, regain control, trying to, if we think of that picture in their brain is kind of out of sorts, and they're trying to make sense of that picture. So yeah, I think that's a really interesting and important thing for us to remember, that I never have the magic words. It's gonna, they didn't give that to me at social work school. It's like, oh, you're fine.
Give you the wand?
Yeah, no, I mean, the person's fine as they are when they came to me. Their life is great. They just need help with a few things, and so the normalizing and validating people, I think, is the biggest thing on any given day, and sharing space with them, and just saying, you might have never shared with anybody else that during a sexual scene, maybe a person likes to be choked. It's okay. How can you do it safely? Because we don't, I don't think that can go wrong really quickly.
Yeah. So how do we make it safe? How do we understand why that's something that turns you on? How do you make sense of it? I mean, I hear you just sort of trying to walk through it with them. And
harm reduction. Harm reduction has to be a conversation. Typically we only think about harm reduction within the substance use world. But I would always challenge people that substance use and these types of behaviors go hand in hand, right? And so the mechanism might be very different. But so how can we navigate it with the individual that they're fully informed, and that they also know the alternatives, and they know the risk, and that person may still engage in it. So, let's say a person who is engaging in auto asphyxiation, that's their thing. How are some ways that we can navigate harm reduction? You might view that as self-harm, right? And it may be, but for me, it's not. There's no intent to die. There's no, the person simply wants to use it as a device for sexual arousal. So, making sure someone knows, hey, I'm upstairs, I'm doing this, having a knife close by, so if I get in trouble, so I think being creative and communicating with the person, and then also learning from them, how are some ways you keep yourself safe during this? Because now that's I say that with the caveat of, we never want to use patients as research, right? So that's not, I always caution people, don't come into a clinical setting and expect one patient to educate you for another patient. There's a whole nother mechanism for that. But we're always taking in this feedback. And so something that you hear from one patient, I think, could be advantageous to somebody else down the road. So it's a slippery slope, but.
Yeah. Well, I have to imagine, particularly for somebody in the kink and BDSM community, having to educate people gets exhausting, like having to try and explain. I mean, if you are out or at least seeking mental health services, like if you don't want to be closeted all the time or and want to be able to share this, that educating of other people becomes, I mean, I know in some ways people really enjoy it. I mean, it's one of the reasons it seems like maybe you're out about who you are, in terms of being okay with that. But I guess I just think about my responsibility as the therapist they're going to come and see, to be ready for them. Maybe
Mm-hmm.
I don't know everything about them or their lives or what they like, any of that, but to be ready enough to sort of
Mm-hmm.
not require them to always be educating me. That's
Yeah, I think it's a double-edged sword, right? So my play partners, by and large, do not know what I do for a living, right? And so I am not social worker Aaron in this play space.
Mm-hmm.
Now, obviously, I don't take off my values and ethics, and they're always with me. So it translates differently into how I care for that person. Um, so I think that's one piece of it. Yeah, being an educator can be exhausting, and I think you do find a lot of folks that when they shift into that educate, they you need a clear distinction. This
Mm.
is my play scene,
Okay.
and this is my education scene. I've been out at bars before, and I've had people come up to talk to me about HIV.
Mm.
I'm openly living with HIV. I've done campaigns for the CDC and yada yada. Um, and there's one particular person that we were at JJ's, and it was 1:30 in the morning, and they came up to me to start talking. Every time they come up, they want to talk to me about HIV. And I said, look, I love you. I appreciate you. I'm not the one.
Mm.
I can't. And so I can link you to other people who can talk to you about it, but I'm just here enjoying myself.
Ah.
And so that's hard, especially within the HIV arena, um, as with other arenas. It's very hard. You can't be an educator and a participant at the same time. It's impossible.
Yeah, very different roles. So, I'm wondering, if we could sort of close out the conversation, by sort of this last question I have for you. And so I'm curious what you would say to future therapists, new therapists who are going to venture into this world where they're going to have clients who are part of the kink and BDSM community. What you would say to them, or what your advice would be to them.
Oh, that's a good question. So this is the best advice that I would offer. Um, the so in a pre-COVID environment, when we still had contact with people and other humans, I don't know if we can remember back that long ago, but each year there is a leather event in Chicago called International Mr. Leather. There's also International Mrs. Leather.
Mm.
I would encourage anyone who is thinking about doing this work. It's always held on Memorial Day weekend.
Mm.
It is the event, and I have to say I'm completely biased. I've judged this event, but it draws people from all over the community.
Mm.
The event in and of itself is not what I would tell people to pay attention to. That is like a leather contest, and that's great. But the leather mart downstairs,
Mm.
it has everything.
Hmm.
And so don't just read about this stuff. Go to a space where you can see it. Now, that's obviously you have to navigate your own safety, and so this IML and IMSL, these are zones where there's no drinking and there's age restrictions. So it's a very safe, controlled environment. That's one thing that I would say. I would say to talk to a lot of people.
Mm.
And I'd also say, why does a person want to get into that, right? So anytime that we're doing work, we need to understand what is it that draws me to this,
Mm-hmm.
and to kind of know that. That would be my best advice. That
Yeah.
just be open to the learning. I liked what you said about, I'm going to ask with curiosity. And the moment we lose wonder about the things that we're working with is probably the moment we need to check out of that population. If we're not interested in the folks we're working with, that's a problem.
Yeah. If we sort of stopped. So this is going to sound like weird phrasing, but I think about this in terms of like delighting in someone, like enjoying hearing about them and what's happening for them. And when that sort of fizzles, when we're sort of like, we've lost that spark or that interest, if that's kind of what you're getting at, we need to maybe consider where we're at with that. But the other part I heard in what you were describing there is sort of like, it's one thing to read about people or read about a particular population or even a sex act, right? Like it's one thing to like read about it on paper. It's another thing to sort of show up somewhere and in a real experiential way, create some comfort for yourself and understanding of the community. Is that fair?
Absolutely. I'll give you an example. So in the leather community, there are pups. So these are typically younger. They will wear apparel, dog collars, pup mittens, pup hood mats, mask. They're submissives typically, but they're also very playful. So they're in a playful headspace. And it's not always sexual. It's just that headspace. What I think IML and these other, and they're all around the country. We have a couple of contests a year here. It's not until you're around folks, maybe someone who's wearing a chain and a collar and they have someone holding it. Well, what's that mean? Or there's different colored bandanas, and that's coding. Acknowledgement of bygone era when we couldn't just say what we were into, and rather we needed to code for folks. So having those actual conversations with folks to say, and folks will freely talk to anyone, right? I've very rarely, a couple IMLs ago, we talk about liberation. I walked up Michigan Avenue in a jockstrap. That's it, jockstrap and boots. So the beautiful thing about the kink community is there's this liberated freeness that all we have is our being. And the beauty of a sexual connection that we share with another person is the most intimate thing, right? Next to seeing your child brought into this world, being witnessed as a person leaves this world, and then joining yourself with another human and in these very vulnerable ways, I think is something that we want to do. And to your point, you mentioned earlier at some point about, I forget what made me think of it, but we don't typically view sexual health with the same prestige or the same level of priority sometimes as we do maybe other health domains. I would contend that sexual health needs to be at the very top, right? Because when you have a person who's sexually unhealthy, that manifests into depression, anxiety, all these other things. We also see that person will isolate. So we see that it trickles down, right? And if we can get to a point where sexual health is if when we're doing a triage on a patient, if we move that sexual health question to the very top, I think we would start to see some real results in other areas, because it's a real important indicator of how the person's mental health is, how their behavioral health is, how their ability to connect and interact with other people. Like, you can tell a lot of things by a person's sexual health. And it's not just the fun factor. It's way beyond that.
Well, and it's so interesting. We'll have to close out here after this, but it's so, I could talk to you for like hours about this. So it's so interesting, like to think about all the things you listed there about that sexuality, that intimacy between two bodies is next to seeing your child born, is next to watching someone leave this world. Like the physicality of all of that in terms of embracing our bodies as they are and then what they do. It's so beautiful because for me, those things all line up in terms of some embracing of the physical self in a way that I think too culturally, we really like to stay up here and sort of like cut off from the neck down, which I know is really common in trauma, but like that if we could embrace the physicality of us and how miraculous, like we create humans like out of our bodies and we create like unbelievable pleasure as well, and that those things are actually all part of the whole human experience, that we could really begin to reshape kind of how we think about sexuality and the expression of it in a way that might make all of us a whole lot healthier.
Absolutely. As you were talking, I was thinking about, and it's something I continually work on, you know, accepting our bodies the way it is. It's a beautiful thing. And the messaging that we receive and that folks receive each and every day is that people are not good enough. Work harder, go to the gym, look this certain way, look that certain way. And so Kink, I think for a lot of folks offers that space to come as you are. And the one final thing that, as you were talking, I was thinking about, breastfeeding for women. So we think about these activities where it's such a beautiful activity. It's such a miraculous activity. And yet it's also an activity that is so shamed because we haven't, we live in a society that is very patriarchal and that is very, women do not have control of their body, of any function that happens in their body. And if you're Black or brown, you also don't have any say over what happens. And so to your point of that systemic trauma that has crept in, I think that is where some of it is drawn out of people taking back the power that they have and saying, my body is beautiful the way it is. I will do with it as I want, and whatever enjoyment I have. And I think where our role is and where future clinicians, our role is to reconcile the physical with the mental and make sure that that person doesn't injure themselves or other people as they go on their way.
Yeah, and kind of frees them up. I like that word you used earlier about liberating the body and the mind, and so we can all strut down Michigan Avenue.
It was very free. Very free.
I'm totally jealous. I'm with you. That sounds very free. Well, thank you so much. I really appreciate your time.
Of course.
All right.